it comes to chronic drugs like Ozempic, there are two main narratives. The first suggests that modern medicine treats these drugs as a form of health insurance, acting as armor to protect the body from disease. The second narrative warns that chronic drugs may contain dangerous toxins and ingredients, potentially harming the body and even leading to disease. Understanding these perspectives requires a deep dive into medical literature and history. As we begin, keep in mind that the truth often lies somewhere in between, and it's important to approach the topic with an open mind and a willingness to learn. Ozempic is a prescription drug primarily used for people with type II diabetes. It's administered as an injection under the skin and is prescribed to help manage blood sugar levels, especially for those who also have heart disease. The drug can lower risks of heart attack and stroke, and is often combined with lifestyle changes like diet and exercise. Recently, GLP-1 drugs such as Ozempic and Wegovy have gained attention for their potential to help with weight loss, thanks to their active ingredient, semaglutide, which reduces appetite. Let's explore how these medications work and why they're so widely discussed. Doctors sometimes prescribe Ozempic off-label for weight loss, even though the FDA hasn't approved it for this purpose. Off-label use means a drug is prescribed for a condition other than what it was officially approved for. While Ozempic can help manage blood sugar and reduce cardiovascular risks, its appetite-suppressing effects have led to its popularity for weight management. However, it's important to note that weight loss is not an FDA-approved use for Ozempic, and the medication's safety for this purpose is still under scrutiny. Always consult your healthcare provider before considering Ozempic for weight loss. Ozempic and Wegovy share the same active ingredient, semaglutide, but their approved uses differ. Ozempic is meant for blood sugar management and reducing cardiovascular risks in adults with type II diabetes. Wegovy, on the other hand, is approved for long-term weight management, alongside lifestyle changes. While Ozempic may cause weight loss due to decreased appetite, it's not officially recognized as a weight loss medication. Understanding these distinctions is crucial for anyone considering these drugs, as their effects and regulatory status are not identical. Ozempic belongs to a class of drugs called glucagon-like peptide-1 receptor agonists, or GLP-1 agonists. Other drugs in this class include Wegovy, Mounjaro, Saxenda, and Trulicity. These medications often come in self-injection pens, with varying dosing schedules. For example, Ozempic and Wegovy are injected weekly, while Saxenda is injected daily. Mounjaro targets both GIP and GLP-1 receptors, and Rybelsus is available as an oral tablet. Each drug has its own unique properties, so it's important to understand the differences before starting treatment. Your doctor or therapist will recommend the right dosage of Ozempic for you. Ozempic comes as a liquid solution inside prefilled, disposable pens with strengths measured in milligrams per milliliter. Typically, doctors start patients on a low dose for the first 4 weeks to monitor effectiveness and side effects. After this period, the dose may be increased based on blood sugar levels and other factors. Each pen contains multiple doses, and your healthcare provider will instruct you on when to discard a pen and start a new one. Always follow your doctor's instructions carefully. Clinical studies have shown that semaglutide, the active ingredient in Ozempic, can lead to significant weight loss. One study reported a 5.9% reduction in total body weight after 3 months and 10.9% after 6 months, with doses ranging from 1.7 mg to 2.4 mg. Another study found that patients lost around 15% of their body weight over 68 weeks. However, it's important to note that weight loss may not be sustained after stopping the medication, as many individuals regain weight once treatment ends. These findings highlight both the potential and the limitations of Ozempic for weight management. Ozempic may lead to weight loss by slowing down how quickly your stomach empties after eating. This process helps you feel fuller for longer, mimicking the effects of a hormone called GLP-1 that your body naturally produces. GLP-1 increases feelings of satiety and decreases appetite, which can contribute to weight loss. However, stopping Ozempic often leads to weight regain as appetite returns to normal. Understanding the mechanism behind Ozempic's effects can help you make informed decisions about its use for weight management. Ozempic and similar drugs share some common side effects, including diarrhea, nausea, kidney damage, fatigue, pancreatitis, and diabetic neuropathy. Unique side effects like headache may occur with Ozempic. Both Ozempic and Trulicity carry a boxed warning about a possible risk of thyroid cancer. Serious side effects can include nausea and stomach paralysis, pancreatitis, diabetic retinopathy, hypoglycemia, gallbladder disease, and allergic reactions. If you experience severe or persistent symptoms, it's crucial to contact your doctor immediately. Understanding these risks is essential before starting Ozempic. Ozempic has a boxed warning, also known as a Black Box Warning, issued by the FDA. This warning highlights the risk of thyroid tumors and thyroid cancer, observed in animal studies. If you have a personal or family history of medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2, you should not take Ozempic. Symptoms of thyroid tumors include a lump on your neck, persistent hoarseness, shortness of breath, and trouble swallowing. Always report these symptoms to your healthcare provider immediately. Ozempic and other GLP-1 drugs have been linked to an increased risk of gallbladder issues, including gallstones and biliary diseases. Multiple studies have found that GLP-1 receptor agonists significantly increase the risk of developing cholelithiasis, especially when used for weight loss, at higher doses, or for longer durations. Over 13,000 adverse events have been reported to the FDA, including cases of gallstones and cholecystitis. Understanding these risks is important for anyone considering Ozempic, as gallbladder complications can be serious and may require medical intervention. Gastroparesis, or stomach paralysis, is a condition where the stomach's motility is slowed or stopped, preventing proper emptying. GLP-1 agonists like Ozempic and Wegovy have been linked to gastroparesis, with case reports documenting severe symptoms such as nausea, vomiting, abdominal pain, and bloating. Some individuals have required surgery or feeding tubes due to the severity of their condition. Gastroparesis can be debilitating, and lawsuits have been filed against manufacturers for failing to warn about this risk. If you experience persistent symptoms, seek medical attention promptly. Ileus, a condition where the intestines lose their ability to move food, liquids, and gas, has recently been added to Ozempic's label as a potential adverse reaction. This can cause intestinal obstruction, which is a serious and potentially fatal complication. Symptoms include loss of appetite, abdominal cramping, constipation, swelling, and vomiting. Studies published in 2020 and 2021 linked GLP-1 agonists with intestinal obstruction, but warnings were only added in 2023. If you develop symptoms of ileus after taking Ozempic, seek immediate medical attention. Many lawsuits have been filed against Ozempic's manufacturers, with claims ranging from gastroparesis and ileus to gallbladder disease and pulmonary embolism. Lawyers are helping patients recover compensation for medical expenses, lost wages, pain and suffering, and even wrongful death. The FDA has not approved Ozempic for weight loss, and the drug has not undergone systematic testing for this purpose. If you've experienced serious side effects, it's important to seek legal advice and medical attention. The legal landscape is evolving as more cases emerge. Semaglutide, the active ingredient in Ozempic, may be linked to blood clots such as deep vein thrombosis and pulmonary embolism. Studies have shown an increased risk, with symptoms including leg swelling, pain, skin discoloration, and warmth. Pulmonary embolisms can be life-threatening, blocking blood flow to the lungs and causing symptoms like fainting, chest pain, shortness of breath, and rapid heartbeat. If you experience these symptoms while taking Ozempic, seek emergency medical care immediately. Ozempic's delayed gastric emptying may increase the risk of pulmonary aspiration during surgery, leading to pneumonia or chronic lung issues. The drug can also cause pancreatitis, a serious condition marked by abdominal pain, nausea, and vomiting. Some studies suggest a link between GLP-1 agonists and pancreatic cancer. Allergic reactions, kidney disease, vision issues, and bad breath have also been reported. It's crucial to discuss your medical history and any concerns with your healthcare provider before starting Ozempic. One visible side effect of Ozempic is known as Ozempic face, where users experience a loss of fat from the face, resulting in more lines, wrinkles, and a hollowed-out appearance. This can lead to an aged look, which some find distressing. The drug's impact on fat cells and skin elasticity is still being studied, but it's a notable concern for those considering Ozempic for weight loss. If you notice these changes, consult your healthcare provider for advice. Ozempic and Wegovy are derived from Gila monster venom, specifically the peptide exendin 4. This peptide mimics human hormones that regulate insulin and appetite. Companies use advanced technologies like CRISPR to isolate and modify venom peptides for therapeutic use. While this innovation has led to effective diabetes treatments, it also raises questions about safety and long-term effects. Understanding the origins and technology behind Ozempic can help you appreciate both its benefits and risks. If you're considering Ozempic, it's important to discuss all your concerns with your doctor, pharmacist, or therapist. Prepare questions about how Ozempic may affect your body, mood, or lifestyle. Ask whether Gila monster venom-derived drugs are suitable for you. Bring someone to your appointment if it helps you feel more comfortable. Remember, this information is not a substitute for professional medical advice. Always consult a licensed healthcare provider before starting any medication. Ozempic is a complex medication with both benefits and risks. While it can help manage diabetes and promote weight loss, it carries significant side effects and legal controversies. The FDA has not approved Ozempic for weight loss, and its safety for this purpose remains uncertain. Always consult your healthcare provider for personalized advice. This presentation is for informational purposes only and should not replace professional medical guidance. Stay informed, ask questions, and make decisions that prioritize your health and well-being.
Welcome. Today I'll show you exactly how to join Beautique and make your first purchase. I'll guide you through every step, from choosing your account type to completing your order. Start by opening the main menu to explore our mission and the products section. You can join as a customer for rewards or as a member to start your own business. The sign-up form is straightforward. Just enter your contact details and shipping information. Members will also provide a few extra details to set up their independent distributorship. Once registered, browse our full catalog and select the high-quality products you'd like to try. Once logged in, simply find your favorite products, add them to your cart, and click Checkout Now to complete your order. You're now ready to start your journey with Beautique. We're excited to have you with us.